Hi, everybody. This is Dr. Shahin Ghadir from Southern California Reproductive Center. I want to welcome you to our Men's Health and Fertility Success Seminar. And we are about to get started. We have a great slide deck today that myself and my partner, Dr. Mark Surrey, are going to be talking to you guys about. Hopefully at the end gives us a great opportunity also to do a Q&A and go through questions, and you are welcome to type them where it says Q&A, and at the end we'll try to answer them. So SCRC has a proven track record. We are located in the heart of Beverly Hills. The building that you see the photo of is where our practice is. 90% of the first floor and also the entire 5th floor and half of the 7th floor are our practice. We have been rated as top 10 fertility center in the United States for many years in a row, and we are very excited about the fact that we've been here for many years, over 25 years to be exact, and also have one of the largest and most successful IVF laboratories in the country. It is as state-of-the-art as it can get, and the embryology laboratory is where the embryos are made and the future babies are made as well. We also have an on-site surgery center that is used by ourselves and people in the community, and also in the IVF lab, like I was saying a second ago, some of the most advanced technologies that have come out in the world of fertility. Some of them have even started here as well. We have other locations other than this Beverly Hills office. We now have a Pasadena office and also a Santa Barbara office as well, and we have multiple smaller satellites around Southern California as well. The photo that you see on the bottom is my partner's. My partner, Mark Surrey, is going to be taking over halfway through the presentation, and it's going to be a great set of slides that he's going over as well. Again, I'm Dr. Shahin Ghadir. I'm one of the founding partners of Southern California Reproductive Center. Okay, so one of the things that's very important for our clinic is that we like to make sure that we're giving fertility a holistic approach. We have a state-of-the-art IVF lab, which is great. We have the science behind what we do. We have a phenomenal surgery center that caters to females' health and fertility treatments and surgeries. And also, most importantly, we have a world-class fertility clinic called Southern California Reproductive Center, where we have some of the best staff that I've ever worked with in the past, some of the best nurses, some of the best physician's assistants, and just absolutely lovely women and men that work here on a daily basis that have dedicated their lives to helping people like yourselves have great outcomes with their fertility. I think it's very, very important when beginning the IVF process. And I just want to be very open. I have 4 kids. My middle 2 are a result of IVF. We had a bump in the road after a miscarriage, and we had to do IVF here at our clinic. And the fact that we have such an unbelievable IVF lab has really helped people like myself and my wife have beautiful twins that are now 9 years old and help us have the best outcomes that we can have. One of the things is that our lab director is brilliant. Dr. Jason Barrett is experienced. He's a certified PhD laboratory director who has knowledge and the ability to train people to do the best treatments on our embryos. Every single thing that is done in the lab is double witnessed. It's called double witnessing verification. So eggs and embryos are never worked on alone. Everything is verified by a second person. A blastocyst culture, that is when we are able to take an egg and a sperm and grow them to the most advanced stage possible, which is called a blastocyst. It's the largest an embryo can be outside of the human body before being put back into the uterus and needing implantation. Vitrification is the fast speed. It's like a flash speed of freezing, which eggs and embryos are done, and that is the way that we get the least amount of damage as well. And also, when we have the embryo grow to the blastocyst stage, we are able to do pre-implantation genetic testing for multiple different reasons, checking for chromosomes and certain diseases as well. The 24 chromosome genetic testing is the pre-implantation genetic testing that allows you to have the highest chance of success that SCRC is able to give because the embryos are the healthiest. It is also the same technology that gives us the gender, which is both the X and the Y chromosomes during that genetic testing, which allows people to select for a gender if they care about that. and also our EmbryoScope incubator, which is a time-lapse video analysis of embryos, is one of the rarest incubators and most advanced tools we have available in the world of fertility that we are able to have here at our clinic. And we are very fortunate to actually have 2 EmbryoScopes. It takes 1,000 pictures a day as an embryo grows, and it allows us to see which embryo had the best division process, and also look and see which ones were genetically normal. That allows us then to pick the best embryo possible for putting back into the uterus and having implantation. So one of the things that I wanted to actually discuss is what are some of the most common causes of male infertility, because as many people have now realized, this is not only a female process and female problem. Some of the things that we look at are the quantity or the quality of sperm. Male sperm need to be over 20 million per milliliter, and also quality, which is called morphology, needs to have a beautiful head and a neck and a tail. We also look at pre-existing genetic conditions that can affect male infertility and try to get around them with the treatments that we have. We are also looking at male hormone levels to make sure that they're adequate. We are also considering any kind of prior injury that a male could have that could affect things, and surgeries as well. Infections are looked at, especially sexually transmitted diseases and urinary tract infections, and also things such as mumps. And the exposure to poisonous chemicals and radiation, or if someone underwent cancer therapy, these are all looked at when looking at the causes of male infertility and trying to see what is needed to be done to give the best outcome. So how is male infertility diagnosed? There definitely is a process of getting an excellent history and a physical exam and giving all the information that a patient has for us to understand. Usually this is followed by the most important aspect of this process, which is called the sperm analysis. And sperm analysis looks at the health and well-being of the sperm, because that is ultimately going to be the most important thing in letting us know if someone's going to have problems as a male conceiving or not. So what are the most common infertility issues faced by men? One that we see often is azoospermia, which is a complete absence, so there is 0 sperm. It can be caused by different issues, sorry, not difficult, but different issues. One of them is the one called congenital absence of the vas teferens, and that is a tube that allows the testicle to make sperm and then bring it out for ejaculation. If that tube is missing, we are unable to get sperm out. Also, some of the ejaculatory ducts get obstructed. Varicocele are the thickening of the veins that bring the blood flow away from the testicle. So there's a lot of blood flow, and with that excessive blood flow, there's an increase in temperature, which is not that healthy for sperm. And poor sperm motility or morphology in general, when you're looking at how they're swimming slow or they don't look normal, is a big issue. A previous vasectomy also blocks off the sperm, so that can keep people from getting pregnant. And premature ejaculation, to an extent of trying at home, can become a nuisance as well, as does erectile dysfunction. Jumping back up to the top, oligospermia is when there is sperm, but it's a low number. So these are things that are the most common infertility issues that cause men to have difficulty conceiving. And with those things being stated, we have treatment options that help. So one of those is a vasectomy reversal, which some of our urology colleagues can do. Not all of them are always successful. And also fixing the ejaculatory duct by resecting it, or fixing those thickened veins called varicoceles can all help. So these are all things that we can do in process of the treatment for patients with these sperm issues. With that being said, there are other ways of getting around it in the laboratory as well. One is, if we have low sperm counts, we're able to take the sperm individually, even if they're very low in count, and push them and inject them into the egg. That is called intracytoplasmic sperm injection. And that's the photo that you see on the right, with a special little needle that brings the sperm directly into the egg. And that happens in the laboratory environment with in vitro fertilization. And by the way, the word in vitro means outside of the body, therefore fertilization. So in vitro fertilization, and once the egg is outside the body, we inject the sperm in. The other process we do for people that have zero sperm or they don't want to go through a reversal of a vasectomy is we're able to have our urology colleagues come and actually aspirate sperm through the testicle and get it out of the testicle in a little needle and then give it to our embryologist. And the sperm that is retrieved and aspirated, which is called testicular sperm aspiration or TESSI, is able to be used to fertilize the egg. With that being said, I wanted to thank you guys for listening, and I wanted to introduce my partner, Dr. Mark Surrey, who's going to give a lot of great feedback as well and go through some wonderful slides here too.
Thank you very much, Shahin. That was very well done. We wanted to just briefly introduce you guys to what this IVF is, how it works. So by virtue of the fact that it is a significant medical procedure, like other medical procedures, it's important before we start to get an accurate medical history, physical evaluation, diagnostic testing. So Dr. Ghadir just mentioned about how to do that diagnostic testing and in regards to analysis. And for women, there is a test that's very relevant called an anti-Ovarian hormones blood test. And that's something that women should have done as to whether or not they are partners or egg donors, want to know about what we call their ovarian reserve. So this level of AMH, or anti-Ovarian, is very important to learn about. There is a natural aging process that takes place in a woman's ovaries. And that process is something that's been very well documented. That normal fertility for a woman finishes with age. So what we want to do is accurately, and the way in which we do this is through this anti-Mullerian hormone, as well as looking at ultrasounds. Ultrasounds are a terrific way to look at the reproductive system of a woman. This is an example of an ovary with lots of little follicles. Those follicles can contain eggs. So know that more is better because a significant
Mark, 1 second. Can you just please let us know when you're going to the next slide? And we're happy to move the slide digitally as well, okay?
Great. I think the next slide would be good. So a significant percentage of these eggs that are diminishing in their number, also diminishing in their quality. Slide, please. And we see that with the genetic content of the eggs that are produced, which become increasingly abnormal. So next slide would be great. We don't seem to be able to do that. So we do see that there is a significant decrease in the genetic normalcy of the eggs that are produced. You very accurately described man's semen analysis. So for the male testing, semen analysis is essential. When we look at fertility options, what it is that we can do, we see that there are several different choices. Next slide, please. There are sort of natural cycle attempts at fertility, or inseminations, which imply that a specimen of man's sperm is inserted through the cervix into the uterus, with or without the assistance of ovulatory agents. Next slide, please. And then there's the in vitro process. And you'll notice that there is a very large disparity between the successful outcome of in vitro fertilization, which in our lab is over 78% per embryo transfer, and inseminations. The idea of the insemination is certainly potentially valid, but it is contingent upon a lot of variables, including the fact that the egg that is fertilized is going to divide and develop to a structurally and genetically normal embryo. And when you do an insemination, that all may happen in a woman's fallopian tube if it works. So we can't see it. We can't effectuate it. And there's really not much that we know about it if it doesn't work. With in vitro fertilization, we know what happens. Next slide, please. And the accuracy of it is based upon what we call controlled ovarian stimulation, where we stimulate a woman's ovaries to create more eggs than there normally would be, because we've seen that many of these eggs are not going to create normal eggs. So the more that are produced, the higher the chance the normal embryo result is going to be. This is done by aspirating the eggs by ultrasound internally. So it's not a surgical procedure, but it gives us a lot of information about the likelihood of egg. Next slide, please. So this is an idea of what we see in a laboratory developing over the course of 5 to 6 days, resulting in what we call a blastocyst, which is the stage at which an embryo has to reach in order to create a normal pregnancy. Next slide, please. So if you look at this, Dr. Ghadir mentioned morphokinetic embryo analysis, embryoscope, which we can see embryo development here on the 3rd day at around 8 to 12 cells, and on the 5th day it creates an expanded 100-cell blastocyst. It is at this stage, and only at this stage, where an embryo is able to cause pregnancy. Next slide, please. So when we look at the success rates of IVF, we see that in our lab, as in others, the maternal age dictates the success rates, and that younger patients will have higher success rates. But you'll notice that in our lab, our success rates for our older patients are also relatively high because their embryos have been
Mark, can you speak up a little bit? Some people are commenting they can't hear you well.
Sorry. So what you'll notice is that in our lab, the older patients also have relatively high success rates because their embryos have been genetically tested. This is the reason why older patients usually have lower success rates. So if you do come to what we call assisted reproductive technology, which is the utility of IVF, you want to be sure that the lab that you go to is well versed in performing pre-implantation genetic testing. They have the ability to analyze embryos morphokinetically. That's what we spoke of and we showed you in this video called an embryoscope. Next slide, please. So, we're happy to be available to help you in your journey. There are 6 of us present at this facility, and there are other facilities in the Southern California area, in both Pasadena and Santa Barbara. And whatever is convenient for you is where we'd like to be able to accommodate you. As Dr. Ghadir mentioned, we have a lot of experience here, individually and collectively, and there have been tens of thousands of cases. So technology that can be utilized. We're very happy to see any of you and speak to any of you to see if this would be a good idea for you. So thank you for your attention, and it's nice to speak with you. And we're happy to entertain some questions.
So some of the questions have come up already, and I actually wanted to, there were a couple slides that I think that somehow got omitted from this presentation when it had to do with men's health that I really wanted to address. Some of the things that we talk to males that come in and have poor sperm quality is environmental as well. And I want to make sure that both you and myself address the environmental things, because it's probably the most important things that we can address that someone can do before going straight to treatment. So discussing things like excessive levels of heat that come from jacuzzis, steam rooms, saunas, anything from excessive cycling or spinning that take testicular temperature up. All of those things need to be addressed at one time or another. The use of very tight clothing or underwear, also the use of clothing such as polyester, especially maybe during the nighttime hours when someone's asleep, that take testicular temperature up a lot. Those need to be addressed as well. So those are some environmental things that all are about temperature. But then there's also things that we are able to do in terms of supplementation to help people do better as well, such as male supplements, increasing the antioxidant content as well of their diets, and even prescribing antioxidants as well. So those are things that we believe are really important when looking at sperm quality, not only looking at what's gone on before with like sperm quality, but also the aspects of the rest of someone's life that affect. I tell all of my patients, for example, not to put any kind of laptop on their lap directly, because the excessive amount of heat that comes from one can be tremendous, and it can be avoided as well. Mark, are there any other things that you could think of that we tell people prophylactically to do to improve sperm without necessarily going straight to a treatment?
It's a very good question, because there isn't an absolute answer to it, but some other ideas are that, for example, guys, if you smoke a lot of marijuana, that we know is going to diminish your sperm's ability to move properly. Guys, if you have a few martinis in the evening, every evening, could be an issue for sperm production. That's alcohol intake. I share Shahin's concern about local laptops. There's
Mark,
an interesting...
A little louder, please.
Sorry, there's an interesting question that people have asked about the potential adverse effect on having a cell phone in your lab, which all of us do. And it's really not well known as to the ill effects of any radiation that may come from a cell phone. But probably better to hold it away from you if you can. And then there are always folks who go to your local health store and see products that are supposed to improve upon men's fertility. And, we do know that antioxidants can be helpful. specifically vitamin C and D. It's interesting that most of us, in our quest to stay out of the sun for skin care, also are short of and deficient in vitamin D, which is very helpful in sperm production. So, guys, if you wanted to prophylactically prevent issues, you might think about replacing some of your vitamin D, 2,000 units a day at least, vitamin C, 1,000 milligrams a day, perhaps something called CoQ10, which is an antioxidant. It's very effective, 400 to 600 units per day. And so I would encourage you to think about antioxidants for helpfulness.
I'm going to repeat what Mark just said right now because I think there's a little bit of an issue with his microphone. But antioxidants such as coenzyme Q10 in their purest form, which is ubiquinol, 200 milligrams a day have been recommended for the sperm well-being of men. That antioxidant effect of reducing the damage to cells has been shown to prove better sperm quality. I also wanted to add that naturally increasing muscle mass has also been proven to increase natural testosterone, which therefore can help sperm quality. One of the questions that we have on the side here is that if somebody has been taking testosterone, how long does it take? Because if I want everyone to be aware of this, if you take testosterone or any kind of androgen injection or anabolic steroids, it will turn off completely your own body's production of sperm quality. With that being said, sperm generation takes about 72 to 90 days. So in general, once you stop it, it's going to take a solid 3 months before you get sperm back. And it's important to know that you should be taking your antioxidants, your male supplements that have all the amino acids that are important for sperm well-being, and completely stay away from those products until the sperm comes back. Even for some people, it can take longer than that. And that's why I think it's really important to know what naturally brings the testosterone up. And we do know that testosterone comes from the natural building of muscle mass on the body, which leads me to say also one more thing about weight control, because excess fat on the body, which is adipose tissue, converts itself into estrogen, which is actually very unhealthy for sperm. And actually, one of the reasons why people get breast enlargement, which is called gynecomastia, is not only from the increase in estrogen levels from the weight, but also from the estrogen level. So keeping the weight under control and also being incredibly healthy and increasing muscle mass are some of the things that really can help sperm quality as well, along with the antioxidants and supplements. And I'm going to go and see if there's any more questions that have popped up, and I'll read them out to you, Mark, and you can answer the next one.
Sure.
What impact does Lexapro have on sperm? I think we should just answer that more in a general antioxidants and anti-anxiety medications.
So we're not aware of a specific ill effect Lexapro has on sperm production, but like anything else, if you don't need it, better not to take it. And if you do, better to have it prescribed by a physician. I want to just echo Shahin's thoughts about exogenous testosterone. There are a lot of men who we see who take it not only orally, but also intramuscularly. And like other things that are given by injection into the muscle, they last a long time. So the ill effects of testosterone when administered in that manner can last for months. So be careful if you want to and are interested in pursuing your fertility. Be careful about testosterone injections.
There's another question that came through. What other antioxidants can we take other than vitamin C, D, and CoQ10? I like to actually do a natural route of increasing antioxidants in food. I think that is probably the best way to do it. Increasing a diet such as the Mediterranean diet, I think, and keeping away from packaged foods, anything that has expiration dates on it, is the first thing that I like to tell my patients to stay away from. So I think that other than vitamins, and overloading with too many vitamins is also not the best thing, but increasing leafy green vegetables, blueberries, all berries, all foods that have antioxidant qualities in them, I think is probably the better way to go. I'm not sure, Mark, if you have any other antioxidants or supplements that you think are also beneficial.
I do in my refrigerator, but I think all of you guys should consider what Shahin was just mentioning, and just be mindful of what you consume, because you are what you eat. Very true.
Very true. I did want to remind everyone that there is a code on the screen that says June webinar, and that needs to be mentioned when doing your initial consultation for the 50% off discount. And also that this will be put onto our YouTube channel for anyone that wants to look at it again and see any of the slides again. It'll all be over there as well. I don't see any more questions right now. So if there are no more other questions, I'm going to go ahead and see if Mark has anything else to say before we say a goodbye to everyone.
You know, I wanted to just mention, because we didn't focus on it so much, is that for men who are in a same-gender relationship, you're very sensitive to their needs in regard to creating situations so that you too have a family with a combination of ovum donation and gestational surrogacy. It's something that is done very commonly. I'm happy to speak to anybody interested.
Sorry, I have been looking at the questions through the chat, but right now when I open the Q&A, there's a bunch of questions there that we did not answer, so I'm going to start going through them. And one of the questions was, what is the holistic approach for sperm well-being, which I think we have answered, but one of the questions was, can acupuncture have an impact on sperm? And from speaking to quite a few different acupuncturists, I think there are a couple different locations that they do place needles into that are not anywhere near the testicle, by the way, that does improve sperm quality, supposedly. Now, I am not sure how the studies have been done, and I don't know of any Western studies that have done to show that, but I can tell you from someone who did have to go under IVF, and both myself and my wife went to acupuncture at that time, the amount of relaxation and clearing of the mind that you get during the process of doing acupuncture is very, very, very healthy for the entire being of a human being, whether male or female. And getting your body kind of reset, I think, is a great, great way to get the beginning of good sperm quality and good egg quality and everything else that's involved. I'm looking through some of the questions came into both places. There was a question about how HGH affects fertility. And to be honest, when it gets to that point, usually that is being given from our urology colleagues. Is there anything that you wanted to add about that, Mark? Because I personally don't give HGH to the male partner, and I usually refer to our specialists in the male urology area that specialize in infertility to do that.
Yeah, I would agree. There are ways that you can look at deficiencies with HGH. We seem to notice that it can, in women who have a diminished ovarian reserve, be helpful in regard to egg production. And everyone is different, so I would encourage any of the men considering taking it, or who are taking it, to have an assessment by an andrologist or an endocrinologist to be sure it's the right thing for you.
Another question that came through, Mark, if you drink a glass of alcohol every day, what is the impact on sperm?
It's a quantitative answer in that moderation is probably best. And, if you have a glass of wine at night, it's probably not going to take the average person's sperm production and significantly impact it in a negative way. But if somebody is not producing normal sperm to begin with, then adding alcohol consumption onto that may be a detriment. So I think it depends on the individual.
I only see one more question that maybe we haven't answered, and it says, does Kratom affect male fertility? Kratom. I'm not very familiar with that. I think it's a supplement. I'm not sure, Mark, if you are.
I'm not, but one thing that we neglected to mention in talking about different kinds of supplements, I think, are anti-inflammatories, which can be natural, such as turmeric is something that I've been looking at recently, and I think can be of value to men with low sperm production that you can buy, at health food stores, pharmacies, and can be consumed in lots of foods.
Great.
So thank you, everybody, for joining us.